If there's a possibility I might interrupt you and ask you to start over again
Oh
if
yeah,
you
that's fine.
like use an
Stumble.
acronym or
Sure.
yeah, and if you want to stop at any point and start over again,
Okay.
you totally can.
Okay.
So we're ready. So tell me your name and where you're from.
Okay.
And what year school you're in. Okay.
So I'm Becca Mullen. I'm a fourth-year medical student, originally from Overland Park, Kansas, now getting ready to graduate from the University of Kansas School of Medicine.
Awesome. What's your time here been like?
It's been great. I actually expanded my 4 year of medical school to 5 years, so I was able to also obtain a master's in public health during my time in med school. And yeah, the faculty here, the staff here, all the students, it's a really supportive environment that has a strong emphasis on primary care. And so it's been a really wonderful experience.
You started a high school clinic in Wyandotte County.
Mm-hmm.
Tell me about that.
Yeah, so the University of Kansas School of Medicine is actually located in Wyandotte County, Kansas, which, as many know, is one of the least healthy counties in the whole state, low socioeconomic status demographics. And so there was a high need of adolescents in the county without access to health care and a kind of wide variety of medical issues, including obesity, even hypertension, smoking, asthma, etc. So the family medicine department here at KU and I respond to that need by opening up a school-based health center in one of the local Wyandotte high schools. And it took about 2 years to really get off the ground and become an official pilot, but it's still running now almost 2 years later. It's volunteer run by medical students, first and second year medical students volunteer at the clinic, and as well as family medicine faculty to provide great clinical care to the adolescents there and hopefully make an impact on their health and their current situation.
Is the clinic full every weekday when it opens? Is there like high use?
It is actually. There's a very high demand every fall for sports physicals. A lot of these kids, their families had been previously unable to afford getting a sports physical every year. So in the fall, when it reopens in August, we've seen a huge boom, an overwhelming number, and we have to kind of expand our hours and days that we're open to meet that need. But even after the sports physical season passes and is over, there's still a very high need. A lot of students want the education in regards to nutrition and physical activity. They want to make healthier choices. So they're seeking out the school-based health center services to learn how to be healthier kids. So there is actually a pretty constant high demand there.
That's awesome. Great. So you talk about applying to why you wanted to be a doctor and applying to med school and how you ended up here.
Yeah. So I grew up with physicians as parents, and so I always knew that being a doctor was going to be in the works for me. I never really considered any other career path because I felt so passionately about that. And I also knew that I wanted to be a primary care physician, and I think it's pretty well known now that nationally there's a very high shortage of primary care physicians, as well as in Kansas specifically. But when I was looking around at various med schools, I was looking for a med school that had an emphasis on primary care that seemed to support and nurture that type of environment, which not all medical institutions do. A lot are pro-specialty and kind of go in that direction. So I interviewed at around 11 medical schools across the nation, and I saw a wide variety of facilities as well as opportunities at various med schools, a wide variety of different emphasis and focuses, as I mentioned, in the various classrooms, as well as a wide variety of faculty members in all the places that you interview. You have some interaction with the faculty there, and you can get the vibe of kind of the culture of the institution. And so while I was accepted into other medical schools, I ended up choosing to go to Kansas for a variety of reasons. Most of those having to do with the excellent faculty that I met here, the emphasis on primary care. It seemed to provide an environment where it's easy and exciting to be in primary care, and they want to respond to the need. And in regards to facilities, I think that KU, I saw a pretty wide range of facilities, and that's one of the main aspects that you're looking for as a student when you're applying in various medical schools, because you have such a short time to make an impression of each of these institutions that you're interviewing at. And so I think the KU facilities were kind of right in the middle. They were pretty average. I saw other institutional facilities that were much more high tier, more tech savvy, and it was a very attractive aspect of that school. And but I saw also other medical schools where the facilities weren't as nice as KU. So I think it was right in the middle. I don't think it had any impact on my choice to come here personally. And my choice to come here more had to do with just the environment and the culture of this place.
And also, you said earlier that you always knew that you would find yourself back in the Midwest.
I did. Coming from Kansas, I think there's a culture in Kansas where people who grow up here, they really want to stay. And so I was born and raised a Kansan, and I always knew that long term, working in Kansas was going to be in the plans for me. And so coming back here for medical school not only was attractive because of the people here and the culture here, but also it was smart because, you know, KU really has a focus to produce Kansas physicians. And so that's what I knew I would work in Kansas eventually.
When you guys are in class and your activity for the day is like a small group problem solving, and you're in a room that's not quite set up for that, have you noticed like sort of weirdness or awkwardness, or can you talk about that?
Yeah. So the first 2 years of medical school here at KU and across most medical schools nationally, you spend most of the time in the classroom. It's before the clinicals, it's before you spend a lot of rotations in the hospital. And so at least specifically how it works at KU, typically med students in the first and second year spend the first half of the day in the mornings in one big lecture hall where the entire med school class all congregates to hear lectures from various faculty and staff. And then the afternoons are spent where the med students break up into smaller groups for smaller sessions, whether that be peer-based learning, where medical students gather together to talk about a specific patient case and kind of walk through it, or whether it's a various lab where it's a pathology or microbiology lab. And so, but regardless of what activity you're doing, the first 2 years of med school are completely classroom-based. So the larger classrooms that we have here, while they accommodate the size, they're crowded, a little crampy, and they're not set up for a technologically savvy lecture. It's just the basics. As well as where we break up into small group sessions for the afternoon, those classrooms are actually extremely small and cramped, uncomfortable setup. And sometimes even those classrooms, you really only have a whiteboard or a chalkboard to work with. You don't even have the technologic infrastructure to, as you're going through whatever, if it's the peer-based learning or the labs, to really be able to use the technology and tap into that for our learning experience. So there's a lot of room for improvement.
Is make it work, but you're sort of...
Exactly, yeah.
I don't know quite how to say that because I'm not in the situation. Can you describe that?
Yeah, we do. We make it work, and I think it's all we've ever known, especially, you know, from my class being here 4 to 5 years. It didn't at first occur to us that it would work any other way, but as you realize the opportunities here for expansion and the project, the design that was kind of planned for a potential new building, you realize all the opportunities there would be to spread out. Even, for example, having the students all in one room be able to work in a circle with the current facilities we have, it is so cramped that you're even restricted to the layout of the classroom. And so we made it work, but there's ample room for opportunity and improvement.